Our next speaker is Alyssa Crichton of Columbia University. Her presentation is entitled Engaging Community Partners for Effective Development of Outreach Strategies. Alyssa.
Hi. Thank you, and thank you to everyone for participating today. So, as Nika said, I'm going to be discussing how we've engaged with our community partners to really develop new and exciting collaborations and outreach strategies. So, as a brief overview of what I'll be discussing, I'm going to talk about the recent process we've gone through to increase our community engagement, particularly through our Community Advisory and Stakeholder Board. I'm also then going to touch on three successful examples of events and projects that have benefited from this active involvement of our community board, and then talk about some of the lessons we've learned throughout this process of engaging our community board and increasing their involvement. So quickly, who makes our community outreach and translation core work are a number of individuals. We have two co-PIs, Dr. David Evans and Ms. Peggy Shepard, who's the Executive Director of We Act for Environmental Justice, which is an environmental justice organization in New York. The program is coordinated by both myself and Ms. Oganaya Dotson-Newman, who's the Director of Environmental Health at We Act. Our Community Advisory Board is made up of 17 members, 13 of which are from 12 community organizations, and we have 4 members that are from 3 organizations that do community work that are affiliated with Columbia University. We also have 3 center staffers who participate in our Community Advisory Board meetings. So our community board's purpose is to provide bidirectional communication through revising the dissemination of the center's research findings to the broader community. They also help to ensure that our research is responsive to community needs. Some of the roles that they play include guiding the translation and dissemination of our findings, and they make sure that our translation is bringing the science to a place where it can be understood and applied by a wide audience. They also help in developing a new community-based education project. They're the ones working with our target audience in northern Manhattan and the South Bronx, so they have invaluable insight. And identifying environmental health education opportunities in northern Manhattan and the South Bronx. They have their own networks and contacts that allow us to increase the reach of our materials and messaging. So a brief history of this revitalization process we've gone through. In the first years of our center, we developed our Community Advisory Board, but how it interacted with the center was incorporated with our Scientific Advisory Board at an annual advisory meeting. This was not really an ideal environment for our community advisors to guide our translation and outreach efforts. So after 2005, they separated the community and scientific advisory boards. And during this time, there was the development and initiation of a plan to reinvigorate our Community Advisory Board, and it was redeveloped as the Community Advisory and Stakeholder Board. Since in the past few years, we've had a renewed recruitment effort for our board, and we've seen a growth for our membership. We also increased how often we meet with our advisors to quarterly, and we've really sought to actively engage them in the development process for our outreach initiatives. So starting from the development of an idea all the way to its implementation. To give you an idea of who is a member on our board, so We Act as our main community partner, as I stated before. We also have representatives from government and policymakers, the New York City Department of Health and the Bronx Borough President's Office. We also have organizations that have both a national and a local focus. So we have a lot of different insights and perspectives from our community advisors. Next, I'm going to give some examples of successful initiatives that have really benefited from the active engagement of our Community Advisory Board. I'm going to start by discussing a briefing series, which just had its second briefing. So focus groups that we did in the development of an educational material and our current educational campaign redesign. So first, our stakeholder briefing series. So this was a briefing to give an update on the center's current research and also policy efforts from our community partner, We Act. The target audience was policymakers, government officials, and also leaders in the Northern Manhattan and South Bronx community. Our community advisors were involved throughout the entire process of planning these events, so they helped to identify the topics for discussion. They've also helped in the creation of an invite list and identifying who our target audience should be. And they've assisted in promoting the event and outreaching to their networks to assure that everyone that should be there is. Some of the outcomes is a rather new event. We've only hosted 2. But in those 2 years, we've seen a growth in attendance already. We nearly doubled in 1 year our attendance. And we also saw many individuals who returned from 2011 to participate in 2012's briefing. We've also had really positive feedback from our attendees, a feeling that we're providing information on environmental health that is relevant to the work that they're doing and can be incorporated into their work. And the real goal was a creation of an annual event for information sharing and networking and engaging with our stakeholders, not just our existing partners, but it's also a venue for creating new connections so that we can have new collaborations. My second example is the focus groups that we used in the process for creating our last educational material, which was a BPA tip sheet. The purpose of these focus groups were to determine knowledge, perceptions, attitudes, beliefs, and health behaviors to ensure that we were developing a relevant and culturally tailored material to the Northern Manhattan and South Bronx community. We had 3 focus groups with 24 women, 2 which were conducted in English and 1 in Spanish. And the participants were recruited through 2 of our Community Advisory Board member organizations. The moderator followed a discussion guide which consisted of 25 questions. These questions aim to reveal personal determinants of environmental health and to also get feedback on the tip sheet we were designing on its content and design. And through this process, we really gained insight into pre-existing knowledge about environmental health and also some areas that were not quite as known. Our community advisors were involved in recruiting our focus group participants, also in developing a moderator's guide and hosting the sessions. And the result was a BPA tip sheet that was vetted by the community and for that reason is a more effective educational material. Along the bottom, you can see the progression of visuals from before the focus group, in which you can see the material is a bit wordier and less visually interesting, to after our focus groups and into our final, in which we really streamlined the content to narrow in on the most important message and create a more visually impactful material. And our final example is our educational campaign redesign. The Healthy Home, Healthy Child educational campaign is our center's campaign, and it was created in 2000 in collaboration with WEACT. On the right, you can see some examples through the years from 2000 to 2012 of our materials. In 2005, it won the EPA Children's Environmental Health Excellence Award. And in 2011, we initiated the redesign of this campaign with a new holistic approach. And this approach was identified from community feedback during the focus groups as well as our community advisors. And this new focus broadened it from a single environmental exposure or health outcome. And the feedback we received was that taking an exposure by exposure or a single health outcome approach can result in an overwhelming amount of information that's difficult to absorb. So our new educational campaign aims to give simple steps of things individuals can do to reduce multiple exposures at the same time. And we are highlighting easy, affordable, and culturally relevant alternatives for creating a healthy home. Now, this approach has really been steered by our community advisors as well as community feedback. They've helped in identifying our themes, which you can see on the bottom. We have 6 themes: green cleaning, clean indoor air, eat fresh, toxic-free shopping, reduce stress, and create change. They're also involved in the process of reviewing the content for the materials and giving feedback on what the material format should be and the imaging to assure that we're creating an impactful material. So some of the lessons that we've learned throughout this process of engaging with our Community Advisory Board The first, which is rather intuitive, is that the importance of community participation for the success of outreach and education initiatives. And we've really found that community involvement throughout the process allows us to receive feedback and improve upon our projects. Creating an active role for our advisors throughout the development process from the start of an idea to its implementation has been really important and has improved the success and the applicability of what we do. Also critically evaluating our own processes, and we see that receiving community feedback throughout helps us to evaluate what we're doing. Also thinking about how we interact with our community partners has been important to improving the effectiveness. And finally, creating and maintaining a system for communication. Communication has been integral to engaging our community advisors, and one of the things that we've done is by increasing the number of meetings to make sure that they're involved throughout the year on a regular basis. Of course, our work wouldn't be possible without the support of NIEHS and the EPA, as well as private foundations. And I'd like to say a special thank you to our Community Outreach and Translation Corps, as well as the community advisors that are so important to the work we do and our community members. And last but not least, all of my colleagues at the Columbia Center for Children's Environmental Health. Thank you.
Thank you very much, Alyssa, for such an excellent presentation.